Okay, might get started. Hi, everybody. Thank you all for joining us for this webinar. We are very excited to be back after a bit of a break, and I'm very excited to be facilitating this series of presentations that are focused on applying evidence into practice, which is part of the comorbidity project funded by the Australian Government Department of Health and Aged Care. My name is Christina Morell. I'm an Associate Professor and Program Lead of Treatment and Translation in Complex Populations at the Matilda Centre for Research in Mental Health and Substance Use at the University of Sydney. Along with Erin Madden and Alexandra Azzi, who are both project officers on this project, I have the pleasure of facilitating today's webinar, which is being presented by Dr. Clara Fritchley. Before we start, I'd like to acknowledge and pay my respects to the traditional owners of the lands on which we're meeting and recognise that we are meeting across Australia today. The traditional owners of the lands that I'm currently on are the Gadigal peoples of the Eora Nation, but I'd also like to pay my respects to other traditional owners of the lands across Australia for everyone else who is here. I'd also like to recognise and acknowledge the many people with lived and living experience in mental illness and substance use, as well as their families and carers, many of whom have very generously contributed to the development of the guidelines on co-occurring conditions, as well as our other resources. I know that everyone here is probably too familiar with Zoom by now, but just to quickly let you know before we begin that if you're watching this live or recorded, you're in listen-only mode, which means we can't see or hear you. So just to draw your attention to the Q&A and chat buttons on your screen, please feel free to click on those or the Q&A button and type in any questions you have at any time during the presentation today. We may not have a lot of time for discussion, but we'll try to go through as many of those as we can. If you have any comments or anything that is not for Clara, please use the chat. This recording and slides will both be available to download from the website on your screen there in the next couple of days. If you find Zoom chat distracting, you can have a play around with the settings on your end to disable what messages you see. To do this, you just need to go to the Zoom desktop app if you have it installed, click on the setting wheel in your top right-hand corner of the screen, then select the team chat in the navigation menu. You should be able to change what messages you see on your end by turning the message notifications off. And the link to have a play around with that is on the screen. And I think Alex and Erin can put that in the chat as well, ironically. So to get on with business, today's webinar is on working therapeutically with individuals involved in the criminal justice system. And I promise I will stop speaking in a second and hand over to Clara to get us started. But before I do, just want to mention that we do have some more webinars coming up in the next few months. You can find out more and also register for those at our website. And the link to do that is on our screen there. If you've been to one of our webinars before, you might remember that we ask for suggestions at the end of each webinar. So please take a minute if you have it. Just let us know if you have any topics you'd like to see as part of this series, and we will see what we can do at the end of the talk today. And now it's my very great pleasure to stop talking and introduce our presenter for today, Dr. Clara Fritchley. Clara is a clinical psychologist with over 20 years of experience in both forensic and clinical sectors of mental health care. She has recently completed her PhD examining therapeutic experiences of people involved in the justice system and has a strong interest in how the criminal justice system impacts emotional well-being. In particular, she specialises in work with adolescents and adults who have complex presentations, particularly those who've endured trauma or experienced systemic and structural barriers to good mental health. I am so very glad that Clara is able to be here today and share this with us. So I will hand it over to her to get started. Thank you so much, Clara.
Hi there, my name's Clara and I'm a clinical psychologist based in Sydney. I'm very pleased and honoured today to be here with you all talking about a topic that's very close to my heart, and that's therapeutic work with people who are involved in the justice system. But before we begin and launch into this topic and webinar, I'd like to acknowledge that I'm recording this meeting from the lands of the Camaragal people. I'd also like to acknowledge the traditional custodians of the various lands on which you all work, and any Aboriginal or Torres Strait Islanders who are participating in this meeting with us today. I'd like to pay my respects to elders past, present and emerging, and to celebrate the diversity of Aboriginal people and their ongoing cultures and connection to land and waters. Before we jump into the webinar as well, I'd like to go through the objectives of today, and I hope that what we'll get out of this webinar and what you will come out of with today is the ability to recognise the challenges that arise when addressing the mental health needs of individuals involved in the criminal justice system, understand how to conduct multi-layered case formulations to guide us and to guide our therapeutic work with individuals with mental health conditions who are involved in the criminal justice system, and to identify the core clinical skills necessary for successful therapeutic work with individuals with mental health conditions in the criminal justice system. There'll be time at the end of the webinar for questions too, so if any of these areas don't feel like they've been covered thoroughly, I'd be absolutely more than happy to have a conversation at the end about them, and we can have a discussion. I hope there'll be time for that. So I'll start with a little bit of background about me. As I said, I'm a clinical psychologist. I've worked with clients involved in the criminal justice system on and off throughout my career. I started in a pharmacotherapy clinic in the west of Sydney, and in that role I worked with many clients who are involved in the justice system, some on probation and parole, some in transitional housing, and then I also worked on the merit and drug court programs, which I'll talk to you about later today. I've also worked as an in-reach, which means that you go into the prison system and help link people who are about to be released with community services. And then later on in my career, and much more recently, I've been, or probably not so recently, the last 15 years, I've been doing a lot of work preparing psychological assessments for the courts. So much of the work I've done with people in the justice system has been with people who have mental health disorders and drug or alcohol use disorders. And my interests really lie in exploring how to create therapeutic spaces that are respectful and validating and that prioritise the uniqueness of every individual's experience. I'm really particularly interested in how this can occur when we consider the intersections between individual psychological capacities, individual experiences, and then societal structures such as the prison system or the justice system. More recently, I've completed a PhD which has examined this very topic. I've been looking at the therapeutic relationships for people on the drug court programs, so examining the ways that the therapeutic relationships contribute to people's outcomes on the drug court program, and then more specifically how participants in the drug court program experience the therapeutic relationships and what leads to the feeling of a quality relationship with their therapist. My own experiences of the justice system began when I was quite young, in my early teenage years, when I was immersed in a drug-taking culture. Most of my friends at that time, or a lot of my peer group, were involved in the justice system in one way or another. And when I say involved, they were sort of on the receiving end of some, well, getting into a lot of trouble, I guess is probably the way to put it. During those years, I think when I was about 17, my boyfriend of the time suicided in the custody of the justice system. And that experience obviously was incredibly formative for me and very profound, and certainly propelled me away from drug use, and also forced me to rethink some of the choices I was making in my life. From that experience and others of that time have really contributed to my professional work. I feel incredibly passionate and strongly that people within the justice system deserve respectful, fair, supportive processes, and that we as therapists, workers, staff working within this system have a responsibility to be as skillful and as thoughtful as we possibly can be. So over my career, I've spent many hours and many years being with people who have been involved in the justice system in a variety of ways. There are obviously a lot of other people working in the system who focus more on containment, safety and risk assessment or behavioural management, but my role's always been focused upon therapeutic work and psychological understanding. And so it's from that position that I'm speaking to you today from. I also strongly believe in social justice and ethical behaviour, which I've mentioned before, towards all human beings. So that's also a bias that I need to own that influences my work. Because I'm a therapist, I'll use the word therapist most of the time in this presentation rather than staff or worker. But whether you're a person working with a person as a one-off or you're engaged in a long-term therapeutic relationship with them, I do believe it's the quality of the interactions between you and the individual that will determine whether an interaction is therapeutic or not. And when we talk about therapeutic, that by definition means working towards healing. And we know that humans heal in relationships. Humans are obviously a social species and relationships are critical to our well-being. And we know that both to survive and particularly to thrive, we need connection with others. We know that people are more likely to engage in self-reflective thought and lower defenses when they feel safe and connected in a relationship. And we also know that people are more likely to want to behave in pro-social ways when they feel respected. So I guess the real focus of the webinar today is how we can enhance therapeutic interactions with people in the justice system. Okay, so we know that interpersonal interactions are important in forging stronger relationships, and stronger relationships are important for individual growth. And in terms of psychological interventions and therapy, we also know that successful therapeutic outcomes are in large part dependent upon the quality of the therapeutic relationship. Of all the in-treatment factors impacting outcomes in psychological treatment, it's the therapeutic relationship and the alliance between the therapist and client that contributes the most variance to outcomes. Actually, at least 7 times more the variance contributed by treatment model, which is crazy when you think about how much money gets poured into thinking about what treatment model we use, and less money gets poured into how can we form healthy and therapeutic relationships and interactions with clients. I believe, and there is some research to back it up, that the therapeutic relationship is likely to be more important for people that have experienced marginalisation, disadvantage, have co-occurring mental health disorders or substance use disorders, or who have experienced trauma. Because when an individual's repeated experiences of distress and poor relationships, the quality of the relationship is likely to be more important for their individual growth. Now, I'm not saying that's the case for absolutely everyone, and there's always exceptions to the rule, but for most people this is the case. A broad generalisation, which I will make, is that no work is going to be therapeutic unless there is a focus upon relational quality. Okay, yet despite this pretty well-established knowledge in the broader psychological literature that interactions and therapeutic interactions do matter to people's experiences, very little of the research in criminal justice or the desistance literature has focused on how to forge quality relationships within this context. I guess this is likely and probably to be expected, given that in the past the focus of the criminal justice system has been to deter people from criminal behaviour. And when this has not been possible, to punish people who have offended or to contain people who are considered dangerous from the community and protect the community. But I think, as all of you here are probably very well aware, there's been some really big shifts over the last couple of decades in terms of how we see the criminal justice system, and in the recognition that the criminal justice system is increasingly holding people who have very complex histories of disadvantage, marginalisation and mental health disorders. So here's where the philosophy of therapeutic jurisprudence has gained increasing traction, and many of you may be very familiar with this philosophy. This recognises the human, emotional and psychological sides of the law and the legal process, and the ability of the law and criminal justice system to operate in ways that are therapeutic. It really emphasises the need for more dignified modes of treatment, fairer processes, and highlights the well-being, or the need for us to consider the well-being of people that encounter the criminal justice system. So I guess within this framework, the boundaries of the criminal justice system and mental health disorders treatment have been expanded and integrated. And this integration of approaches acknowledges the interrelationships between mental health disorders, offending behaviour, and the connections between these behaviours and people's health and social conditions. This philosophy has sort of led to or kind of emerged parallel to a huge increase in different various treatments being integrated and implemented within the criminal justice system. So as a result of this shift in philosophy or this shift in paradigm, we really now have many treatment options that are embedded within the system. There's multiple treatment linkage points for clients that encounter the criminal justice system, so people can be referred to treatment upon arrest, pre-sentencing, post-charges, and even post-sentencing. And the idea is that using the legal system as a way to potentially motivate or leverage an individual's motivation is a way to help to engage people in treatment and possibly to retain people in treatment. It's also, I guess, the argument for this approach is also to offer opportunities to engage in treatment for people that may otherwise not be able to A, afford it, or B, access it. And a further argument for embedding treatments in the criminal justice system is that what we're doing with this system is helping to start to address people's issues or the underlying issues that lead to offending behaviour. Rather than just as a surface level dealing with the offending behaviour, we're trying to address what is contributing to their offending behaviour. I will say, though, to balance out the arguments for embedding treatment in the legal system, there are many arguments against, and it's, you know, integrating treatment into the justice system has not been without criticism. You know, integrating treatments and therapy within this system has been argued as a way to disguise some of the problematic elements of the justice system. In particular, the way that the justice system tends to target, I guess you could say, people of racial minorities, people of disadvantage, people who are marginalised, people who have low socioeconomic or education status, people who have significant mental health or mental health disorders, including drug use disorders. So in some ways, embedding treatment within this system has been argued to sort of mask the carceral roles of workers and therapists and people who work in the system. And so to sort of soften, in a sense, the domination and control the criminal justice system can have on people's lives. There's also criticism that embedding treatment options within this system may also lead to a net widening effect, which means that people may be pulled into the world of prisons and courts who previously wouldn't have been involved in the name of sort of giving them access to treatment. People may be charged with crimes, you know, that they may not have necessarily needed to be, and judges may lay down convictions with the justification that this is providing a person with access to treatment. This net widening effect has been argued, or, you know, to end up bringing in people into the justice system who may not necessarily need to be there. So this other side, or these arguments against the approach of embedding treatment options in the justice system, kind of highlight the complexity that we're dealing with when we work within this system. It's not as straightforward as give a person access to treatment. There are many nuances and many sort of conflicting opinions about it. So I think I've basically spoken to this slide. There's pros and cons, obviously, of integrating treatment into the justice system, and it's good for us to be aware of both sides of the argument when we're working within this system. I'm going to start talking to you a little bit about some of the research I've conducted. I will premise this by sort of saying, I think as workers within this system, there are two very important things that we need to be aware of, foundational things prior to even starting our work with individual clients. One is that we're dealing very, very often with populations that have significant vulnerabilities and disadvantages. So we need to know the population that we're working with. I mean, of course, there's great variation within that population, but we do need to be aware of the population we're working with. And two, we need to be aware of the system and the context and the framework we're working with. How does the legal system impact the way we therapeutically work with clients? So I'm going to talk to both of those points now, First, I'll start with a little bit of background about some research that I conducted as part of my PhD. I'm going to use the statistics in this to illustrate some aspects of the population that we're working with when we work in the prison system or the justice system. But although these statistics are very specific to the drug court, they do actually mirror and parallel the statistics that are found across the justice system in general, and particularly the prison system, I should say. So with my research, I'll just back up a little bit. With my research, I conducted studies. I conducted a study in the New South Wales Drug Court. I interviewed participants who were engaged in the Parramatta and the Sydney drug courts. So there are currently 4 drug courts in New South Wales. There's one in Dubbo that has recently opened, I believe, in the last 2 years. 2 in Sydney, one in Parramatta and one in the CBD of Sydney, and one in Toronto, which is near Newcastle. So my study had a sample size of 93 across the 2 drug courts. I didn't interview people in Dubbo or Toronto, basically due mostly to logistics. So the key demographics of the people I interviewed were that most were male, which is unsurprising given that the majority, there's a high percentage, a higher percentage of men in the criminal justice system than women. Most were born in Australia. There was 1/3 of the population were of Aboriginal or Torres Strait Islander background, and that is very, very similar to the prison population. Obviously, frighteningly so, that such a high proportion of people of Aboriginal and Torres Strait Islander background are engaged in the justice system. Almost 70% of the sample had been homeless, so you can see that they're a sample, or they're a population of people who have been quite unstable in their living conditions and who have experienced some pretty significant adversity in their living conditions. Again, 70% or almost 70% had a family history of substance use, and almost 1/3 had been removed from their parents' custody of a child. So pretty significant early childhood trauma for 1/3 of the population. Many of them as well, almost 70%, had been in treatment for drug and alcohol disorders in the past. So they had been in the system and had received treatment in the past. You can see from their age of first drug use that many of them were very young when they first started using drugs, and we do know that the younger a person is when they start using drugs, the poorer their drug use trajectory is going to be. It's a risk factor, the early onset of drug use, for later problematic drug use. And the majority of the people were sort of under the age of 16. You can also see here that the problem drugs in the sample that I had were methamphetamine, so ice, and then heroin. This has changed over the course of the drug court history. Many people in the past were heroin dependent, and obviously with heroin there's many opiate substitution pharmacotherapies, so treatment for heroin dependence can have a dual sort of focus of pharmacotherapy with psychological support. Now this is changing to a population that is predominantly using meth, and that kind of puts more emphasis, I guess, on therapeutic relationships in many ways, because at the moment there's no pharmacotherapy substitute for methamphetamine. Again, mental health conditions were pretty significant. You can see that over half the population is experiencing depression, anxiety and stress. Personality disorders were high, and PTSD is over 1/3, or over 1/3 of people in the sample had symptoms of PTSD. And again, traumatic event exposure is also high, particularly in childhood. You can see that 1/3 had been sexually assaulted as children, and over half had been physically assaulted as children. So very high rates of trauma. So even though this sample is quite specific and it is a drug court sample, not a broader kind of sample of people in the justice system, when I have looked at the comparisons between my sample here and the broader prison system, they're very comparable. You're sort of looking at very, very similar statistics, if not slightly higher in some areas, particularly in the mental health disorders in the broader prison system. So why I bring these statistics to you and why I wanted to comment on them is because when we're talking about how to work therapeutically within this system, I think the first thing we need to acknowledge is that we're working with quite a vulnerable population. Not everyone, as I said before, but many, many people have disadvantage, have been marginalised, have experienced trauma, have mental health conditions, have had unstable housing, have lower rates of education or lower levels of education, etc., etc., etc. So we really need to be mindful as therapists, workers, staff coming into this area that this population is marginalised, is disadvantaged. And we do also know from intersectionality theorists, some of you may be aware of, that often disadvantage is cumulative. And it's not just one disadvantage, leads to this and the other disadvantage leads to that, but the cumulative effect of multiple disadvantages can lead to a very, very difficult experience of life. Okay, so the second really important thing that we as therapists or staff or workers within a legal framework need to be considering before we even embark on clinical work with an individual client is that we need to think about and be aware of the framework within which the therapeutic interactions are occurring. So that is the legal framework. I mean, despite decades of research that has found that the therapeutic relationship contributes the largest portion of in-treatment variance to outcomes, there's very little guidance on how therapeutic relationships within a legal framework can be established and developed. And this is a really important area or a really important gap in the literature, in my opinion, because a fundamental difference in the context of therapy within a legal framework relative to other settings is actually the therapeutic relationship. I mean, when I started out working with people within the legal system, I was faced with many questions. How should I navigate my responsibilities to the justice system as well as my commitment to my client? Sometimes clients didn't come to appointments or told me they'd used drugs or were spending time with people that they shouldn't. And I had an obligation to report back to the court. There were some pretty clear limits to confidentiality. But how should I do this? How could I do it without the client hating me and without breaking the therapeutic rapport? And should I encourage my clients to be open with me, knowing that there were limits to confidentiality? Was my commitment to supporting the client in what they wanted or needed in achieving better or was my commitment to achieving better outcomes for the system? And was it my responsibility to make sure clients didn't do the wrong thing? Would I look incompetent if my client was doing the wrong thing? I didn't really have answers to those questions back then, and still there are probably no simple or straightforward answers, but I do have a much better sense of what works and what doesn't work, and what approach can be used to strengthen the capacity to engage therapeutically with clients within this system. So even at the beginning of my career, over 20 years ago, I had a pretty strong sense that therapeutic relationships developing in this framework were different to other settings. But in what ways? So what I think is the most important thing to recognise is that in this setting, we as the worker or the therapist occupy a hybridised position, both as a support person and confidant to the client, while at the same time working alongside law enforcement with the protection of public as a primary interest. This puts us in this strange, blurry, borderline space and a dual role of care and control. And the boundaries of the therapeutic relationship are therefore kind of, blurry, I guess, and can be tricky to navigate. Because within a legal setting, there are often reduced treatment choices for clients. Clients often have few choices about the therapist they see, how often they want to come to therapy. They can often experience significant consequences if they miss their therapy appointments, or if they don't participate appropriately. And therapists and workers often have really heightened power over the client. I mean, the power imbalance is present in all therapeutic relationships, but within a legal framework, it's amplified tenfold, because therapists and staff can often have the power to revoke a client's liberty if they report certain things back to the court. It's important to recognise when we're coming into this sort of work that these coercive aspects of the legal system, such as the heightened power differentials between the therapist and the client and the significant negative consequences imposed for non-compliance, can actually be traumatogenic. They can actually parallel experiences of previous trauma. And we know from what I just spoke about that we are working with a vulnerable population where high rates of trauma and marginalisation and disadvantage and relational difficulties have been present. On top of that, the lack of privacy and the scrutiny and the surveillance of individuals' lives within this context can actually amplify challenges in establishing relational safety and certainly impact the connection with the therapist. For the client, questions around trust and safety with the worker often arise. Negative perceptions towards the worker as someone who's representing a system that may have caused them harm, or that they may experience as traumatizing. For the worker or therapist, questions around how to navigate the limits of confidentiality, the dual commitments to the client and the legal system, and the complex and hybrid role that we as therapists occupy can sort of dominate our approach to the therapeutic relationship. So, first and foremost, all of us working within this context need to recognise that the clients coming to us have complex needs, and secondly, recognise that we have a very complex legal system that surrounds the therapeutic relationship, and both of these things are going to influence how we engage therapeutically with our client. The framework and the system will subtly, or often not so subtly, influence and impact your relationship with your client. So ignoring or pretending that it doesn't impact the relationship, or that the relationship should and will develop in ways similar to other settings, will not assist you in your therapeutic interactions. We need to recognise these two things. That as a general rule, people in the criminal justice system are very likely to be highly vulnerable and disadvantaged, and two, that relationships developing within this context are going to be influenced and impacted by the context. But then, though this foundation though these ideas or ways of thinking give us a foundation for working in this context, obviously then each client within it is going to be different. And we want to ensure that we have an individually responsive approach to each client that comes to us. Each client within this system is going to be unique, and we know that providing an individually responsive approach is going to be the best way to be therapeutic. So I'm going to move on now to case conceptualization within the legal system. Because when we start working with a client or getting to know an individual, we want to start thinking about what's going on for that person. We want to ask ourselves, how can I understand what's happening for this person as best as I possibly can? Obviously, case formulations take different forms depending on which theoretical model you're using, and generally speaking, they involve assessing an individual's symptoms or current difficulties, assessing possible contributing factors, and the way past experiences may have contributed to what's occurring, as well as assessing maintaining factors. In the criminal justice system, obviously, they also can involve risk assessments, the likelihood an individual may continue to engage in offending behaviour. My opinion is that to begin to work therapeutically with clients in this space, a multi-layered case formulation is not only important, but actually critical to establishing a solid therapeutic foundation and a foundation to ethical interactions with the client. Obviously, you can have your own theoretical models and they can fit within this multi-layered way of conceptualizing a client, but I would argue that we need to consider not only the individual's immediate context and individual history, but also the wider social context and social history. So thinking in this way kind of involves a shift towards formulations that don't focus solely upon the individual in the here and now, but they also take into consideration the individual within their wider context as well as the then and there. So things that have happened in the past and historically. This kind of formulation also takes into consideration power dynamics, both in the immediate relationship and also within the societal context that can be based on dimensions such as race, socioeconomic status, gender, indigeneity, age, sexual orientation, among other things. So it involves a comprehensive integration and a look at the different layers of influence upon a person and how these will then affect the interactions that you have with them. So here I'm in this table, you can see sort of in front of you, I'm outlining the multiple levels that I believe we should be thinking about our client within. I mean, this doesn't mean we need to discuss all of this with our client, and nor do we need to spend hours dwelling upon each level, but holding in our mind a consideration and awareness of these influences should be part of our conceptualizations in the criminal justice system, because each of these levels will influence how the person comes into relationship with themselves and with us, and will provide a fuller and more holistic understanding of the person. And I would definitely argue that a fuller understanding and a more holistic approach will often lead, and very often, and if not always, lead to fairer and more respectful and ethical ways of relating with our clients. So I'll briefly summarize the levels. I mean, you can see them here. So the things that we should be thinking about when we're formulating or conceptualizing a client is firstly the psychology of the individual. So that involves the individual's internalized norms, their values and beliefs, their sense of self, their relationship with themselves, and their emotional and psychological sort of functioning. Then we need to look at their material circumstances, so their socioeconomic status, how they fit in with their community, their skills, potentially their employment or education, and maybe some of the intersectionality dimensions that we've talked about as well. So how the cumulative aspects of their life may add up to contribute to how they experience their circumstances. Then I would argue we need to think about the structures around them, and here I would really highlight the legal system. You know, when a person's involved in the legal system, that can often be quite a significant structure in their lives. And so thinking about how that's impacting them and how they're relating to that. Then we need to think about society as a whole, so the response of the community to people who have offended, people with mental health disorders potentially, people of different racial backgrounds, and think about the access that the individual in front of you may have to services, to resources, to people who may be able to support them. And then I would argue thinking about the historical trajectories, so societal approaches to people who have offended over history, how that may impact how a person sees themselves within a community, the history of colonisation, and systems of oppression that may impact how a person sees themselves in relation to their community. And then we can also look at global trends of understanding and responding to offending behaviour and how that may impact an individual. Okay, so being able to see the myriad of biopsychosocial and historical and societal processes that make up a whole individual provides, in my opinion, a more unifying conceptualization that makes sense of the individual and their place in the world. It opens up a far broader way of understanding an individual and the therapeutic processes and relationships, with a fuller recognition of the processes that are at play in each interaction. I would always argue for a more complex and multi-layered conceptualization and formulation of a person, and I do believe that communicates to the person in front of us that we see them holistically, we see them as a whole person, we see them as a person that is complex, we see them as a person that is, has capacity to change and shift and move, and I do believe that will always help us strengthen our relationships with the person. Very often people in the criminal justice system are used to being seen as a set of symptoms or a set of problems or a set of difficulties. And having a conceptualization that's broader and is complex and that is able to hold space for multiple dimensions of a human's existence will, I think, always be a good foundation to communicate respect and communicate that a sense that you see the person more fully. And of course, we can never see a person fully, but this is a way to communicate a more fuller presence to our clients. And just a really quick note on this, a case formulation should never be a closed system. It's dynamic, and as a therapist, we need to keep integrating and incorporating new information into it as we get to know the individual. People change, information changes, our knowledge changes, and we need to keep an open system so that we keep integrating that into how we see the person. Okay, so now we've talked about some of the foundational ideas for what we need to be aware of coming into this work in the criminal justice system, and then about how we can conceptualize and formulate our clients in a way that leads to ethical interactions. But now let's think about how we can engage therapeutically with clients in this framework. As part of my PhD, I did spend some time interviewing people on the drug court. I interviewed 20 people, and I did spend some time sort of drawing out qualitatively what to them leads to quality therapeutic relationships. What I have tried to do is sort of integrate those findings with my own experiences in work, and also with some of the other literature in the area, though there's not an awful lot out there about how to behave or how to enhance therapeutic relationships within a criminal justice system. There is some work in the area of procedural justice, and probably many of you are familiar with that, and I won't go into it today, but a lot of that work is complementary with what I'll be speaking about. What I will outline today are the 6 core areas that I believe are necessary for therapeutic work in this population, and these have arisen from my own research and qualitative research with clients in the drug court program, but also from my own clinical experience and other literature. So my focus is generally on here in terms of when I'm talking about therapeutic relationships, it's generally how to work within psychological treatment interventions that are delivered within this framework. But I do believe actually much of what we'll talk about can apply to any interaction in any sort of professional capacity that we have when we're working in the justice system. So the first competency or the first skill a professional will need in this area is to recognise and acknowledge that the criminal justice system is a unique framework in which to be engaging therapeutically. I've talked quite a bit about this already, but it's impossible to separate therapeutic relationships from the legal framework in which they arise. The legal framework is going to impact your therapeutic relationships. I have talked about some of the challenges that arise in this context, but interestingly in my research, many of the individuals engaged in the drug court also felt that the legal framework could actually enhance the therapeutic relationship. They felt that it sort of held them in treatment, which actually allowed them, time to get to know their therapist and for a bond to sort of grow. I have seen some similar research in a population in China where in qualitative interviews they found that individuals felt that the legal framework sort of enhanced the therapeutic relationships by holding them in treatment. This was also in a drug-using population, so it's unclear at this stage whether that's specific to drug-using populations of people who have offended, or whether it may more broadly apply to the justice population. It does highlight, though, that the legal framework will be experienced differently by different individuals, and we as therapists cannot assume that each individual will experience it in the same way. But the core competency, I suppose, that I want to highlight here is that it will influence the therapeutic relationship, and we as clinicians, staff, workers, therapists need to be able to be comfortable and competent in having open conversations with our clients about how this framework is experienced by them. What are the challenges they experience in it? How is that affecting the relationship? Sometimes it may be even helpful to provide them some psychoeducation about the constraints of the legal system on the therapeutic relationship as a way of preemptive normalizing. You know, this can help both the client and the therapist to sort of feel, or this can help the client, I should say, more than the therapist, to feel that they have permission to talk about some of the constraints and the impact of them upon, the impact of those constraints upon them. The second competency or skill that I'm just going to touch on is the therapist's therapeutic stance or attitude. How we are as a worker really does matter in terms of how therapeutic we're going to be. And I've listed 4 things that I think are really important here within this, within the legal framework. And one is presence, being in the here and now. So being with the person and attuned to the person, but also holding awareness of the then and there. What has this person experienced? What disadvantages has this person endured? What historical experiences have influenced their behaviour? Patience, a capacity to wait and allow and trust. A recognition that people will come to the encounter with their own history of experience. So really avoiding sort of dismissing someone who's engaged in the criminal justice system as not knowing or making bad choices or being unaware, but actually holding a stance of patience to help the person to kind of identify their own sense of wisdom and what is important to them. An openness and transparency, and I guess that touches slightly on the previous point, that we need to be able to hold all of the client's difficult emotions, difficult feelings, responses to the system that they kind of find themselves in for whatever reason. And we want to be able to, as therapists, hold space to have open discussions and encourage clear communications of the legal obligations that we have, the dual roles that we hold, but also that they are allowed to have their own feelings and opinions about that. And then I guess we also want grace and humility. And that, I suppose, involves not holding, kind of sharing of power in some ways, like in the sense of we hold grace and humility and compassion that can come from realizing that we as therapists are not immune to life's problems and challenges. Okay, the third clinical competency that I think is very important in order to enhance therapeutic interactions is the ability to sort of demonstrate genuine or to have genuine and authentic care for the person in front of us. And that comes from seeing the client as a whole person rather than a set of symptoms or problems, attuning to the client's needs and providing an individualized response where possible and within the constraints of the legal system. I mean, obviously, where that's not possible, communicating that in a really clear way. Collaborating with the client around their hopes and desires. Collaboration obviously is really important, particularly for people that have felt disadvantaged and marginalised. You know, when a person feels they have no power, being allowed to share some of the power within therapeutic processes or within conversations is an actually incredibly important and incredibly therapeutic part of strengthening connection. And also validating a client's emotional response to their circumstances. Providing clients a sort of space to begin to articulate, identify and then articulate what's going on for them. Okay, the fourth competency or clinical skill that I've outlined, and that what did arise when I spoke to people who were receiving therapy in a legal framework, is that of the ambivalence. And so I guess as therapists, we need to acknowledge and recognize that many clients are going to come to the therapeutic encounter or the therapy or the encounter with the worker with a lot of ambivalence and potentially trepidation. And that's often driven by the experiences of past trauma or the experiences of systems that have kind of marginalized or squashed a person's power. So commencing therapy is obviously an anxiety-provoking experience with apprehension on the part of the client being the norm in all settings. But some of the aspects of the legal system, like the limited choice of attendance in treatment, the reduced ability to cease or miss sessions should a person feel overwhelmed, the heightened power differentials, all can lead to pretty significant ambivalence on the part of a client in terms of their interactions with you. So the clinical implications of this is that we as therapists working in this space need to really assume that ambivalence is going to be the norm. We need to assume that it's going to be present. It doesn't mean that a person's lazy or not motivated to change or doesn't care, or that you're not good enough as a worker or you're not competent in kind of encouraging a person to change. What it means is that a person is really going to be struggling with this sort of desire to change, but also experiences of past trauma, potentially negative experiences of the system, and all of this is going to lead them to really struggle to quite know how to engage. And in my experience, the clinical skills that we need to encourage that is permission to speak about it firstly, acknowledgement that it's really understandable and pretty normal, and then help the client to articulate and put words on their experience and what they're going through. And this will allow it to be sort of worked through and for you to kind of come to a more collaborative stance. This leads me to the sort of fifth skill, which is the encouragement of self-identity and self-articulation. As it's, we know that people who have come from marginalized, disadvantaged backgrounds, who have experienced trauma, very often may and certainly have experienced stigma, very often may struggle to articulate or feel entitled to express their points of view. It came up a lot in my interviews with drug court people, this feeling of not being entitled to talk about how they felt or not being entitled to express what was going on inside them for reasons such as, the experience of trauma through their earlier life, through the experience of stigma, through the experience of sort of being shut down by systems of power. So as therapists, to enhance therapeutic interactions, we really want to be encouraging a curiosity and an inquiring mind towards our client's internal experience. Nothing is off limits. We want to be encouraging the clients to take that curious stance towards their own existence and their own internal experience, because we know that being able to identify and be in touch with and articulate our internal and validate our internal experience, all of those things are going to be incredibly important to enhanced well-being. Okay. And the very last skill or competency that I believe a therapist needs when working in this space is the recognition of ruptures in relationships. Ruptures are very common in therapeutic processes. We know that. We know that. There's plenty of literature out there that has highlighted that. But within a legal setting, what I've found, and this has not really been discussed very much in the literature, but what I have found in terms of interviewing the people that I did and also in my clinical work is that when ruptures occur within a legal system, clients are most often likely to use subtle withdrawal methods. So because they can't get out of coming to therapy often, because there'll be significant consequences to not coming, they use emotional withdrawal, which may look like answering questions in a yes or no way, providing only superficial kind of answers to questions, avoiding any sort of talk about emotional debt or talk that is emotionally deep, and really kind of just trying to keep things very safe in the therapeutic interaction. All of these things are very natural. If a rupture's occurred, a client is going to naturally want to protect themselves. But as therapists, we need to be really alert to this. because we also know from the broader literature that ruptures that go unnoticed or unrepaired actually lead to worse therapeutic outcomes. Whereas rupture repair, when a rupture occurs and the therapist can repair it, can actually provide the opportunity for a corrective experience and the successful navigation of interpersonal conflict. So it's very important that we as therapists are aware that this is how clients within the justice system are going to most likely respond when there's a rupture. And if we notice subtle emotional withdrawal, that we do our best to name it and to ask the questions in a curious and gentle way of the client. You know, how are you feeling? How are you feeling about what we're speaking about? Did you have a response to X, Y, or Z if there's something that you hypothesize may have caused a rupture? So that's really important, I think, as therapists working in this framework to realise and to be aware of. Okay, so I think I've really talked long enough, and I know we probably would like some time for some questions. Just very, very quickly to summarise a few of the points that I hope that we've covered today. The first is that therapeutic interactions and therapeutic relationships are really critical in this setting if we want to support change and psychological change or transformation for people involved in the justice system. We really need to spend more time and investment on understanding how we can foster, develop, and use these relationships therapeutically. We need to recognise when we're working in this area that there are qualitative differences in these therapeutic relationships. They differ from other settings, and we've talked a lot about that. And then we need to think about, in approaching the individual clients, how can we kind of hold complex models of case formulation? How can we avoid reducing a client to a set of symptoms or problems? You know, how can we as therapists hold complex conceptualizations and formulations that kind of communicate respect and will lead to ethical therapeutic interactions? And then there are 6 core relational or core competencies, skills as therapists, workers in this area that we need to be aware of. I mean, there are probably many more that we can have a discussion about now too, but those are the sort of 6 that in my work and then as well in my qualitative research with people in the drug court kind of have stood out to me as ones that we really need to hold front of mind. Okay, well, I'm going to leave it there. Thank you so much for listening, and I look forward to any questions, comments, shared experiences that you may have. Thanks again. All right, bye-bye.
Thank you so much, Clara. That was fantastic. Some really important and complex challenges for clinicians and a lot to think about. We have had a lot of questions come through, but we are running out of time. We won't be able to get through all of the questions that have come in, but please be assured that the ones that we have been sent, we will send them to Clara, who has said that she will answer them, and we'll put the answers to those on our website along with the recording and slides from today. So please keep them coming if you have any more that you have been holding off on. But we probably just have time for one quick question, and it's hard to choose one, but Clara, would you be able to maybe answer, how do you find working therapeutically with people whose crimes are significantly serious? And do you, or how do you protect your personal values and boundaries, but still perform your job professionally in line with the duty of care to your clients?
I think that's a very complex question.
Maybe not one to answer in a minute.
Not a heck of a lot of time to answer. I mean, look, that's really challenging, particularly when somebody's crime is very out of step with your own values as a clinician. I think that's an incredibly difficult question to answer. And in a nutshell, I suppose, look, it is certainly, I mean, I'm all for complex ways of thinking. So really thinking about all the different angles and how you feel as an individual, how you feel as a professional, how the client may be experiencing what they've done. But really, I think holding space for all of those different complexities and seeing the person as a human being first and foremost is what I would always try to do, and find a way to connect on a human level. My experience is that people don't necessarily want to be antisocial. You know, there's a lot of things that happen in a person's life that lead them to behave in ways that harm other people, and trying to connect with some level of the humanity that may be there. Most of the time I find helps me then to be therapeutic in my interactions. But I mean, look, of course, we're human ourselves, and we have to protect ourselves and have good boundaries, and certainly communicate those clearly to a client. And if a client is in some way encroaching upon us or behaving in ways that don't feel okay with us, there is absolutely no, you know, we absolutely have to set our boundaries and protect ourselves too.
Yeah, I really appreciated what you were saying throughout your talk and just then as well, about seeing the client as a whole person rather than a set of symptoms or problems, which is something, you know, we talk about a lot in our work in terms of trying to work with a person as a whole rather than treating their illness in isolation of the person.
And that, look, that doesn't involve necessarily, obviously not condoning or excusing or not seeing the harmful things that they have done to other people as well. It absolutely doesn't mean that that's what we're trying to do, but it means that we're trying to hold all the different pieces of the picture in our minds, and then really be thinking very reflectively about how we can work therapeutically with them to help them become who they want to be, and also to work with them to connect more in a pro-social sort of way with other people.
Thank you. And I see that there's lots of comments coming in, and I know that you will be able to post some of the answers, maybe not having thrown you on the spot for those online. But just before we end, I wanted to let you all know that you can find out more information about our guidelines, which this seminar series is linked to, and our other resources at our website on screen there. And thank everybody again. And of course, thank Clara for having joined us today for the webinar. And if you're interested in viewing this recording, registering for our other upcoming webinars, or having a look at our library of previous webinars, you can do that at our website. And our next webinar in the series is going to be on the 28th of May, and that will be Associate Professor Louise Newton talking about the impacts and effective treatment options of alcohol use in older adulthood, followed by Dr. Marley Bauer speaking about the role of social connection and loneliness in the well-being of people experiencing homelessness and substance use in June. Until then, thank you everybody for joining us today, and thank you so much, Clara. Please enjoy the rest of your day.
Thanks for having me.
Thank you.
Bye-bye.
Bye.